I was talking with a GP recently about how we might reduce the prevalence of fax machines in general practice.
Yeah.
And his response was, well, how will I talk to the specialists? Anyway, I wonder what your view is, because it really is a change management piece to move from a current practice with faxes to a digital.
Totally. So look, the Australian Digital Health Agency isn't just responsible for health record, it's actually responsible for supporting implementation of the new National Digital Health Strategy in Australia. And one of the key priorities for that strategy is the removal of the fax as far as possible from the clinical conversation. And the way that can be effected is by nothing more complicated than essentially secure email. So we're working with providers across Australia and their industry vendors to develop a new approach to what's called secure messaging, just to enable secure correspondence from one clinician to another without the need for a fax machine. But you're absolutely right that even with the introduction of those kinds of pretty basic technologies, the real challenge isn't a technological one, it is a cultural one. It is supporting the specialist, the general practitioner, the nurse, everybody really to understand how to take best advantage of these digital tools. So one of the big priorities again of the strategy and of all of us in the agency and in all our stakeholder partners is supporting the clinical workforce to learn more quickly how they can realise the benefits of these new digital tools. But I would say that is a much bigger challenge sometimes than people realise. And it's often something that's forgotten in technology programmes. So just would like to reassure you and other partners that the way the agency thinks about this, as I said, is not really to think about technology per se, it is to think about the change and the outcome that's being realised. And in the middle of all that is the active participation and engagement and leadership actually of the clinical community in Australia.
Thank you very much, Tim. That's been a great discussion and I really appreciate you taking the time.
Thank you.
Bye for now. See you next time.